Well, good morning, everybody, and thank you so much for joining us on such short notice. We do have an important announcement today that we'd like to share with the community. It's my privilege to introduce to you Paul Pollack, who is the President and Chief Executive Officer of Silver Cross Hospital, and he'll be sharing our news. Followed up, we have several other people who'd like to comment on the announcement. Paul?
Thank you. Well, good morning, everyone. And I want to thank you for coming because I know you all have a busy schedule, but at the same time, we think this is an important event for Will County. I've had the good fortune to have been here 26 years. And over the last couple of decades, at least in my opinion, we've seen some dramatic and significant changes in healthcare. Pediatrics with Lori, medical and surgical, robotic surgeries. We do hundreds of those procedures every year. Orthopedics, hips and knees replacements are very popular now. Most of you probably know about our affiliation with the University of Chicago for oncology, and then our affiliation with neurosurgery with Northwestern. But you know, we look at the whole perspective of healthcare, and we felt at this time there was one area that really needed some attention, and we're not the only ones that felt that way, and these kind gentlemen will tell you about their opinion. I think you all know that just about 1 out of every 4 Americans, unfortunately, suffer from mental illness or substance or chemical abuse. That's a high number. So we've been looking at this subject for a number of months, and then in December, our board at Silver Cross approved us to build a 100-bed psychiatric hospital on the Silver Cross campus. And the campus is this plot of land that you're on right now, as well as we have about 50 acres across the street. Our partner in this is a firm by the name of HealthVest, and they're a firm that has far more expertise in mental health, chemical abuse, substance abuse than most community hospitals, including Silver Cross. We got a great name picked out for the new hospital. It's going to be called Silver Oaks Hospital, and most of you know that we have to apply to the state for permission to do this, and there is a committee called the Illinois Health Facilities Service Board that will make the decision, and it's our intention to submit the application in February. If all goes well, we're hoping the hospital will be ready in early 2019. Some good news also is that we'll also be creating 200 new healthcare jobs. And as we all know, when we build a new hospital, you're also creating hundreds of construction jobs, which is good for the economy of Will County. As I mentioned before, HealthVest is a large company that really specializes in this, and they're going to be able to bring inpatient, outpatient programs, and ER programs that we currently don't have. So this is going to be a vast improvement for mental health services in Will County. Today we have the good pleasure to have 3 fine gentlemen with us who have a strong perspective and opinion on this subject, and I'm going to invite them to come up and speak and let them tell you how they feel about this. And I'd like to start off with our Mayor, Tim Baldwin. Tim?
Thank you, Paul. Thank you, Ruth. Thank you, everybody, for being here today. As the mayor of New Lenox, one of my first duties when I was elected in 2007 was to work to help bring Silver Cross Hospital to this site here. It's, in my opinion, one of the best things we did as a community. This is an area that at one time, over a decade ago, was talking about 2 million square foot of retail. Well, as we know, the way that shopping is done nowadays, that's changed, and in my opinion, to our benefit. Silver Cross Hospital has been a wonderful partner with us here in New Lenox, and we are thrilled to see the expansion of quality healthcare services for our residents and for the entire area. I have spent 22 years in law enforcement, and quite often I saw people who suffered from some form of mental illness that were thrown into the criminal justice system because we didn't know what to do. And it was not the right answer. It continues to be a problem. In my opinion, in this country, our inability to acknowledge and deal with mental illness is one of our biggest problems. Well, I also had a brother at the age of 19 that committed suicide. And as Paul had so eloquently stated, approximately 25% of the people in the country at some point in their life suffer from some mental illness or some disability. So as the mayor of this community, it's absolutely my pleasure to stand here today and to say that I welcome this expansion. I've had an opportunity to speak with the partners that will be joining Silver Cross. I'm confident in their ability to provide a much needed service for not only New Lenox, but all of the Will County area and beyond. And so again, thank you, Paul and Ruth, for all you've done. We look forward to this partnership with US HealthVest, and as the mayor of New Lenox, I support it 100%. Thank you.
Will County State Attorney, Mr. Jim Glasgow.
This hospital that's going to be built is nothing short of a godsend. And I want to give credit to Judge Policondiotis, who is here today, for urging the hospitals to consider a facility like this. When we closed Tinley Park Mental Health, you've heard Tom Dart, the Cook County Sheriff, talk about how his jail is now a mental health hospital. We're getting near that at the Will County Jail. This is, with all the specialty courts that we have now, in order for them to function at full speed, we need beds. Everybody's heard of Linden Oaks and Rosecrans. Well, that's what this is going to be. We're a county of almost 700,000 people. It's long overdue. And leave it to Paul Pollack to be the one to bring it here. Because back in 1995, when I came to him, we were trying to open the Will County Children's Advocacy Center without going to referendum and just do it at the grassroots level. He came through and gave me a 3,000 square foot suite to put the center in at no charge. And that's how we got off the ground. And it's kind of ironic, here we are again with Paul. He's on the verge of retirement, but unfortunately I'm not. But he's going to leave quite a legacy here with this new facility. We've got a domestic violence court, we've got a drug court, we've got mental health court, we've got veterans court, we have the Redeploy Illinois program. All of these courts, in order to be functioning at their peak, need a facility like this. And I just want to say to anyone who fears having a mental hospital in the area that they have nothing to fear. This is going to be a secure facility. We're going to have the top psychiatrists in the area working there, and they'll be working hand in hand with law enforcement. There will be no danger to anyone from this facility. Quite the contrary. If we don't have this facility in order to properly treat these people so that their medications are managed when they go back on the street, then they'll be released in a very unsafe condition. So that's the thing people should fear, is not having this hospital as opposed to having it. So again, there was a deputy that told me that the Child Ad Center was a godsend. This is a godsend, and we should cherish it. And I'm going to be working on my letter to the state to make sure that this becomes a certainty.
And finally, our good friend, Mr. Larry Walsh, our Will County Executive.
Well, good morning, everyone. It's great to be here. What an honor to take part in bringing this to the general public. Paul, thank you very much. Ruth, you two have done just a tremendous job here in Will County. Since moving out here, there isn't a finer medical campus, I believe, around, and second to none. And every time you make an announcement, you improve that campus by partnership with another group. And let me say this, is that the other speakers have said that this is a godsend that we have this. When Tinley Park, just across the border, was operational, we felt somewhat comfortable that we had a place that we could have our citizens that needed this help be able to get it. And when it closed down a number of years ago, we did the best, and everybody has tried to do the best. Our Will County Health Department, our Will County Community Health Center has done a tremendous job, and I definitely am pleased, and we were going to make sure that we offer our willingness and partnership with you in any way, shape, or form that we can to help out. These citizens that need their medication, they need treatment, and to have a facility designed and opened and are the great in what they perform is going to be super for Will County. As Mr. Glasgow said, we're a community, a county of over 700,000 residents, and I'm proud to say that partnering with Silver Cross Hospital and what's the name?
US HealthVest.
HealthVest in Will County, we are going to be able to bring the best of care and attention to our citizens that need it. So, for speaking on behalf of Will County, thank you, Paul. Thank you, Ruth, and thank you, the board of Silver Cross. They are always out there in the forefront, pioneering and doing what's necessary to make Will County a great place to live and raise our families and work here. So thank you very, very much.
So if the state of Illinois approves this project, it will be a 68,000 square foot facility, and as Paul said, it'll have inpatient and outpatient services. 200 new healthcare jobs will be created, and numerous construction jobs. Once we have the bids in, we'll know exactly what that will look like. I'd be happy to take any questions at this point. Bernie?
The Tinley Park facility was a state facility.
Yes.
This will be private, I assume, and so who's going to come here, who's going to pay for it, and all that?
Yes, so the project will be fully funded by US HealthVest, and everybody will be welcome to come to Silver Oaks Hospital, regardless of their insurance or lack of insurance.
And is this going to be a long-term facility for people, or is it going to be a
No,
short-term?
no, it's a short-term facility, not a long-term facility. It's for acute treatment of mental illness conditions, substance abuse conditions, but then there are numerous outpatient programs that patients will be enrolled in, so there's less recidivism.
And State's Attorney Glasgow, could you? Do you see yourself recommending people coming here people who are arrested and in need of treatment or suspected treatment?
Absolutely. And, I mentioned Judge Policondriotis. She presided over the drug court for years, and now she's presiding over the Veterans Court. And she's very passionate about this, so I know she and the other judges will work with us to make sure that this facility is utilized to the max. But the sliding scale, the deferral with regards to no insurance, that's huge. I mentioned the other facilities that are north of us here. They're very nice, but if you don't have insurance, you can't get in. And that's a danger to society. I mentioned Redeploy Illinois. We're getting jobs for convicted felons. We're offering them the chance not to go back to prison and get a job and stop the cycle at DOC. That saves every taxpayer a boatload of money. The same is here too. I mean, whether or not you're compassionate or not, this saves money, because if we manage this mental illness that this person has and they're on the appropriate medication, when we release them, they'll be a law-abiding citizen and we won't have any more problems. And this aftercare that Ruth mentioned is huge, because without that, the first time that they're released, it's going to be a little bit of a struggle. So they need to be weaned away so that they are responsible and they manage their medication, and we'll make sure they get their medication. That's huge. And so whether it be property crimes or violent crimes, once this thing is online, we'll see a significant drop.
Could you talk about 100 beds, is that enough, or is it, I mean, how is that number determined?
We think 100 beds is the right size. Right now, there is a need, according to the state, for 16 beds. Silver Cross has 20 beds currently on our campus, so those beds will be added to the hospital. But when we look at the demand and get the information we're gathering from the Will County Community Health Center and other federally qualified health centers, and from Judge Carla, who's helping us look at the number of people that pass through the courts, we think that we will easily be able to justify a 100-bed hospital.
No, but I mean, is the need more greater than that?
It could be greater, and we'll make sure that we build it so it can be expanded. Yes.
Do you expect a relationship with the Veteran Affairs Commission as well and the returning vets?
We certainly hope so. U.S. HealthVest, which is the company that will be our partner, has made many, many overtures to the Veterans Administration and would love to have a relationship, if not a dedicated unit for veterans. Okay. Well, if there's no further questions, Tracy Simons has given you all press packets. If you have questions, feel free to contact myself or Tracy, and we're very appreciative of you coming today. Thank you.